presentation, I am going to discuss on what is called an organizing hematoma in the urinary bladder. I wish you all infinite blessings from wherever you are around the world. Once again, my name is Mr. Chitumba. So what is an organizing hematoma? Let us see from this case that I scanned at our radiology department. So what you are seeing here is our urinary bladder. Here you can see anechoic urine, you can see here, but when you come here, you can actually see that there is this lesion that you are seeing here of mixed echogenicity. So this lesion that you can see here was forming around the catheter bulb. So you can see the catheter bulb that we have here. So you can see that this lesion is forming around the catheter bulb. So this lesion has got no direct communication with the walls of our urinary bladder, as you can appreciate or as you can see from this. So this is what we essentially call an organizing hematoma. So we are saying that blood is clumping or is clotting around our catheter bulb, as you can appreciate from this end. So this is what we then call an organizing hematoma, or the clot is forming around the catheter bulb. So when someone is bleeding in the urinary bladder, or there is a bleed from the kidneys, so the blood can actually accumulate in the urinary bladder, then it can form a hematoma. So when there is an external or a foreign body in the urinary bladder, then the blood can actually clot around that foreign object. In this case, we have got our catheter bulb, and you can actually see that the bladder is forming around the catheter bulb. So this is a typical example of an organizing hematoma in the urinary bladder, a vesical hematoma. So coming to this again, you can appreciate what I'm talking about. So this is not a distinctive mass, because you can see that it doesn't have obvious attachment to the urinary bladder. So it's appearing like it's floating and it's attached to the catheter bulb, as you can see or as you can appreciate from this video. You can actually see that the lesion is here, and on color Doppler the lesion didn't have color Doppler, so it is a non-vascular lesion, as you can appreciate. So this is a typical example of what we refer to as a hematoma. So this is a hematoma that is forming around the urinary bladder. It's organizing. The hematoma is organizing. The same lesion, this is our urinary bladder. You can see the urinary bladder there filled with this urine there, and you can see the lesion that we have here. So this is a lesion, it's irregular in outline, and you can see this area is actually hypoechoic, this area is hyperechoic, so it is got mixed echogenicity. So this is in keeping with an organizing hematoma. So I think you can appreciate what I'm referring to, or what I'm talking about as the hematoma here that we have. So you can also have got other lesions in the urinary bladder. You can actually have cancerous lesions in the urinary bladder. You can also have other non-cancerous lesions in the urinary bladder, of which they can have attachment to the urinary bladder, and they'll be feeding from the urinary bladder. So this is a case of what we refer to as a vesical hematoma. I hope you are doing well wherever you are around the world. I hope our voice is resonating with your needs. I hope we will keep on addressing your needs so that you become better practitioners wherever you are around the world. Stay blessed. Also, don't forget to subscribe to our channel for more. Thank you so much.